Chemicals are present in many everyday products, from household cleaners to personal care items. And women often experience higher exposure due to their role in society, which leads to specific health risks. Promoting safe alternatives and raising awareness about the potential effects of chemicals on women's health is crucial. By incorporating gender-responsive approaches into chemicals management, we can protect and empower women globally.
En tant que femmes, nous sommes plus sensibles de manière différente à l'exposition aux produits chimiques et à leurs conséquences sur la santé, principalement à cause de notre physiologie, notre constitution biologique, des types d'exposition professionnelles, des expositions aux produits de soins personnels et les produits ménagers, ainsi que de nos situations sociales.
Women's roles as primary caregivers and household managers often increase their exposure to hazardous chemicals found in cleaning products, food packaging, and indoor air pollution from cooking fuels. These daily exposures contribute to long-term health risks, including respiratory diseases, endocrine disruption, and reproductive harm. Raising awareness and advocating for safer alternatives is essential to protecting women's health and well-being.
At different stages of life, we know that women's bodies undergo significant physiological changes that can influence how toxic chemicals are absorbed, processed, and stored. Exposure to hazardous substances during key periods such as pregnancy, lactation, and menopause can have lasting effects, not only on women's health, but also on future generations.
Women and men have different biological and physiological makeup, face different social determinants, and have different social roles. We are exposed to chemicals differently based on our occupations and social situations. Women are impacted differently by toxic chemicals during certain critical windows of development.
Many women don't even know that they're being exposed to hazardous chemicals at the workplace. Studies have shown that women have a much higher risk of breast cancer when exposed potentially to EDCs and carcinogens. These types of jobs can include working in agriculture, in manufacturing, cleaning, and many other types of jobs.
Cultural norms also impact women and girls' vulnerabilities to chemicals. Only about 10% of estimated 13,000 chemicals used in beauty and hygiene products have been safely tested. Studies have conducted that women of color, independent of socioeconomic status, face higher risk of exposure to chemicals as a result of using products such as skin whiteners and hair products, which often contain toxic substances including heavy metals such as mercury and lead.
Katika sekta ya kilimo ambapo matumizi ya viuatilifu hatarishi ni kawaida, zaidi ya 40% ya kazi katika nchi zinazoendelea hufanywa na wanawake na wasichana. Mara nyingi wanakosa elimu na vifaa vya kuwasaidia katika kujikinga na madhara ya hivi viuatilifu hatarishi. Na kwa vile wanawake wanakuwa na jukumu ya kuwahudumia pia watoto wana uwezekano wa kuathirika na viuatilifu pamoja na madhara makubwa katika ukuaji na utoto wao.
Women also make up most of the workforce in the textile sector, electronic sector, and the healthcare sector. We may be exposed to a cocktail of chemicals at work. These are very chemical intensive occupations that use thousands of chemicals, so many of them are hazardous.
Dans les pays en développement, les femmes qui travaillent sont exposées aux produits chimiques toxiques. Elles ne portent pas d'équipement de protection et n'ont pas l'information adéquate. Il existe des cas documentés des femmes qui souffrent de problèmes de santé graves tels que les cancers, les troubles de reproduction et autres maladies très graves.
El tema de las mujeres y los productos químicos necesita más atención científica y política y se deben tener en cuenta algunos puntos de acción clave. En primer lugar, hacer hincapié en la importancia de la participación igualitaria de las mujeres en la gestión de los productos químicos. Y en segundo lugar, la necesidad de priorizar la protección de las mujeres como grupo altamente susceptible a los efectos adversos de la exposición química.
To achieve scientific and policy attention on the issue of women and chemicals, a number of intermediate steps should be taken, such as increasing the availability of information in the public domain about product information on chemical additives and their health effects, and further establish policies and systems to support the substitution of hazardous chemicals with safer products. There is also a need to form policies that focus on phasing out hazardous chemicals with especially high impact on women.
Companies should take responsibility for the toxic chemicals in the products they produce and the impacts they have on our health and environment, particularly on vulnerable groups. As consumers, we should exercise our right to know and demand information disclosure and the substitution of hazardous chemicals with safer alternatives.
So gender-responsive policies are essential in chemical safety and environmental protection. Women must be actively involved in decision-making processes, from regulatory framework to corporate responsibility initiatives. By incorporating gender perspectives into chemical management, we can build a safer and a more sustainable future for all, ensuring that women's unique vulnerabilities are recognized and addressed in policies and actions.